সুপ্রিয় দর্শক, আমন্ত্রণ জানাচ্ছি ইম্পালস হসপিটাল নিবেদিত স্বাস্থ্য বিষয়ক অনুষ্ঠান আপনার স্বাস্থ্যে। আপনাদের সাথে আছে আমি প্রফেসর ডক্টর ইকবাল হাসান মাহমুদ। আমাদের আজকের আলোচনার বিষয় স্কিন কেয়ার। এই বিষয়টি নিয়ে আলোচনার জন্য আমরা আমন্ত্রণ জানিয়েছি থাইল্যান্ডের ভেস্তানি হসপিটালের ডার্মাটোলজিস্ট ডক্টর ডুয়াংকমলকে। ডক্টর ডুয়াংকমল, thank you for coming in our program. Swadika.
Swadika.
You are a dermatologist.
Yes.
In a renowned hospital,
Yes.
Vestani Hospital in
Yes.
Thailand.
Yes.
So, how do you feel in this country, coming after this country? Your
This is
impression?
the second time for me to traveling to Bangladesh. It's very nice country. I like Bangladesh people. They are very nice, very friendly
Friendly.
and polite.
And Thai people also very friendly.
Yes, Thai people very friendly and very nice
I
too.
visited many times in Thailand, and every time I like their hospitality, food and culture, everything. However, my question is, your specialization is in dermatology. So, what is the significance of dermatology in your practice?
I'm dermatologist. I study more in dermatology. Dermatology is the branch of internal medicine. We learn more about the skin, about the cosmetic and disease of skin, nail, and hair problem.
দর্শক, ডক্টর ডুয়াংকমল কিন্তু স্কিনের বিভিন্ন রোগ ব্যাধি নিয়ে চিকিৎসা করছে, বিশেষত সৌন্দর্য চর্চায় একটা বিশেষ ভূমিকা রাখছে। কিভাবে স্কিন কেয়ার সুন্দর করা যায়, কিভাবে স্কিনের রোগ ব্যাধি দূর করা যায়, এভাবে ডক্টর ডুয়াংকমল কিন্তু ভূমিকা রেখে চলেছেন ভেস্তানি হসপিটালে। ডক্টর ডুয়াংকমল, কসমেটিক সার্জারি, ইউর আই থিঙ্ক ভেরি ইম্পর্ট্যান্ট part of your duty, I think. What you do for in cosmetic surgery, cosmetic treatment?
I have many experience about cosmetic dermatology. We have many procedures in the hospital that can make you more younger and very nice skin, such as the one procedure that I would like to talk about, the Botox injection. I think it's very famous now. Yes. Botox injection is the chemical substance. I use this Botox for a long time and it has no side effect. After I use Botox injection in the patient that has the eye wrinkle, the forehead wrinkle, the glabella wrinkle. After injection the Botox, you will see the result. After injection, only 3 to 7 days, and the result persists with you for 4 to 6 months.
4 to 6 months.
And the side effect that you can see after injection is only bruising or swelling, but a little, not so much, but it will disappear in 3 to 5 days.
Okay. If some patient has or somebody has diabetes or hypertension or any other disease, you can use Botox injection, or any other contraindication is there?
It's not the contraindication if I injections Botox in the patient that has hypertension and Botox, but I recommend to inject in the stable patient.
Condition.
Yes.
Is that the blood pressure should be controlled, diabetes should be controlled?
Yes, yes.
So I think a Botox injection, is age is the factor, or the condition of the skin is the factor? Suppose one person aged 60 years, 70 years, 80 years, lots of wrinkles is there, or a younger girl, she also may develop a wrinkle.
Yeah, I think Botox injection work in every group of the age. But it depends on the dose that I use. But someone that has very severe wrinkle, we combine with the other treatment for a good result.
Other treatment, what treatment?
Such as the filler injection, or if you are very old, we can consult with the plastic surgeon to do surgical facelift and combine with the Botox injection. But if you don't want to do surgical facelift, we have the non-surgical facelift. We call thermage. Thermage is the radio frequency.
Okay.
Yeah, we use this machine is the radio frequency. We use this machine for tightening of the skin. It helps you for shallower, for the nasolabial fold, for tightening the skin, for the submental fold, for the unidentified jawline. You have the time with me only 1 or 2 hours for the procedure, and immediately you can go to have normal activity because you have only the redness, but it will gone in only a few hours. And you do only one treatment, you will see the result after do the treatment at least 1 to 6 months, and 15% will see the result immediately. And one treatment, the result persists with you for 1 to 2 years.
2 years.
Yes.
Okay. দর্শক ডক্টর ডোঙ্কামল যা বললেন সেটা হচ্ছে যে অনেকে বলি রেখা পরে কপালে পড়ুক, মুখে বা এদিকে যেদিকেই পড়ুক, এই বোটক্স ইঞ্জেকশন দিয়ে ডক্টর ডোঙ্কামল ভেস্তানি হসপিটালে তারা চিকিৎসা করছেন, এবং এই যে বলি রেখাগুলো পড়ছে সেগুলো কিন্তু আস্তে খুব তাড়াতাড়ি মিশে যাবে, এবং এগুলো উনি সাফল্যের সাথে করে যাচ্ছেন। ডক্টর ডোঙ্কামল, another thing is cosmetic treatment, mainly anti-wrinkle treatment you told already. Is it?
But
is
I
it,
have
is
the
it,
other laser.
Other laser.
Yeah, that can stimulate the new collagen. We can use it to stimulate the new collagen in the people that doesn't want to do Botox injection. But for the laser, you have the downtime is no downtime. It's only the redness, but it's will gone in a few hours. But need many treatment to be improved. But if you want to see the result in a short time, I recommend Botox injection. And we have the other razor, such as intense pulse light, is the right that tell you for more brightening, for uneven color on the face, for the freckle, for the melasma, for the hyperpigmentation. After, if you have the pimple and the pimple gone, it leaves the hyperpigmentation. It tell you.
Okay. Another thing, very important thing. Every lady or every man wants to be white. So you do whitening treatment in Vestani Hospital.
Yes, yes.
So any age factor or the color, what sort of color people should have to come to you to change their color? That is, people want to be white. So what is the indication? What is the parameter?
Yeah, do you mean that procedure that I recommend? I have many procedures that can recommend to do more brightening and whitening, such as the one is topical medication. The second one, recommend to use a sunblock. The third one, we have the equipment. We have the new modern equipment, intense pulse light that I mentioned. It tells you for more whitening, from brightening, tell you for the dark spot on the face. And we have the other treatment.
দর্শক, ডক্টর ডোঙ্কামল যেটা বললেন যে অনেকে তো সবাই তো ফর্সা হতে চায়, সুন্দর মুখের জয় তো সব জায়গায়, তো বিভিন্ন ধরনের চিকিৎসা ভেস্তানি হসপিটালে ডক্টর ডোঙ্কামল করছেন। কিভাবে আপনার ত্বককে আরও ফর্সা করা যায় সে ব্যাপারে তারা কাজ করছেন। ডু ইউ ইউজ লেজার থেরাপি ফর হোয়াইটেনিং?
Intense pulse light is the right, okay, but yeah, but we have the other laser that can help for whitening, for the dark spot on the face, such as we have the Alexandrite laser. If you have the problem such as the freckle on the face, we can use this laser to remove the freckle for you.
Okay, okay.
And I saw many patients from Bangladesh that go to Thailand to see me has a problem such as you saw that you have the tiny small brown pepple around the neck or some or allowed on the face. We use carbon dioxide to remove it, and do only one treatment is gone.
Carbon dioxide laser.
Yeah, we can use this laser for removing the mole, seborrheic keratosis, and the wart. The wart is a viral infection or other skin tumor.
Okay. ডক্টর ডোঙ্কামল যেটা বললেন দর্শক, যে যদি কোনো পিম্পল থাকে বা ছোট ছোট টিউমারের মতো থাকে সেগুলো কার্বন ডাইঅক্সাইড লেজার দিয়ে তিনি ভালো করে থাকেন। We will now discuss after this break some disease condition you treat in Vestani Hospital. Suppose atopic dermatitis. Lots of patients with atopic dermatitis.
Yes.
I think lots of patients are coming to you. What you do and what is the presentation of the patient?
The first common skin problem that I found is atopic dermatitis. Atopic dermatitis is the one type of eczema. The symptom is very general, dry skin and very itching. Itching. I think itching is a problem.
Is it an allergic condition?
It's not an allergic condition. It's has the history of allergy, family history.
Family history allergy.
Yes. So and develop atopic dermatitis.
What you do when you get a patient with atopic dermatitis?
Atopic dermatitis, the patient that has the atopic dermatitis is very, very dry skin. So it's very important to take care the skin, how to take care the skin, how to use the moisturizing cream, the soap, how to taking a bath, how to use the water, and is a I recommend to take care the skin. But if have very severe problem, I recommend to use topical medication together.
Topical medication.
Yeah, and topical medication will relieve the inflammatory symptom.
Is it steroid medication? Or?
There are many types of the medication. It's a steroid and non-steroid. But I try to use non-steroid cream first. Yes, because I think it's very safe.
It's safe.
Yes.
But eczema is you told that is a family history of allergy.
Yes, has the allergy history.
Any anti-allergic oral medication you suggest?
Allergy medication.
Anti-allergic oral medication.
Yeah, if if the patient have very itching symptom, I recommend to use oral medication together.
Antihistamine.
Yeah, antihistamine because to stop itching. Because if you always itching, you scratch it, and you have infection, and infection will stimulate the atopic dermatitis more.
দর্শক ভেস্তানি হসপিটালে ডক্টর ডোয়াংকমল যেটা বললেন সেটা হচ্ছে অনেক রোগী আছে অ্যাটোপিক ডার্মাটাইটিস বা এক্সিমা নিয়ে ওনাদের কাছে আসেন। ওনারা বিভিন্ন ধরনের অয়েনমেন্ট বা টপিক্যাল মেডিকেশন অ্যাডভাইস করেন এবং মাঝে মাঝে মুখে খাওয়ার জন্য অ্যান্টিহিস্টামিন জাতীয় ওষুধ দেন যাতে ইচিং চুলকানি না হয়। ডক্টর ডোয়াংকমল, another thing is melasma, very common condition in Bangladesh also.
Yes.
I think in Thailand same. What is the treatment style? Is it curable?
The melasma is the cosmetic problem. Cosmetic problem. The cause of this is you have long-term exposure to the the change of the hormone after pregnancy, or from some medication such as hormone or oral pills. So you said that it's already gone? No, it's off and on, but we will treat. You know that the cause of the melasma is mostly from the UV, so I recommend to use sunblock every day.
Sunblock?
Yeah, and sunblock you use every day. Because sunblock can protection from UVA and UVB, and UVA and UVB this is a cause for the melasma and for the wrinkle on your skin.
But many person has to go in the sunlight condition in the.
Do you mean the SPF? Yeah.
Yes.
I recommend SPF 50 plus because SPF is mean that protection from UVB, but plus mean protection from UVA.
Right.
Okay, and this is a protection. This is a protection for the new melasma. But if you have the melasma, we need to treat for your confidence. Okay, one is a topical medication. Such as the whitening cream or topical medication that you will go to see the doctor for stronger medication. You cannot buy in the pharmacy. You will go to see the hospital. In the hospital only.
Over the counter is
no. If you have very darkening on the face, the most medication that available in pharmacy is not enough for you. You will go to see the doctor, and we have the other treatment such as the peeling, the chemical peeling, the treatment micropeel, and I have the IPL. Is the intense pulse light that I mentioned. Is this the light that can decrease the activity of melanocytes? That is the cause of melasma. We can suppress activity of melanocytes, so melasma is decreased.
Okay, দর্শক মেলাজমা যেটা মেস্তা যেটা বাংলায় আমরা বলি, বাংলাদেশের অনেক মহিলা কিন্তু এই সমস্যায় আক্রান্ত জর্জরিত এবং এটা থেকে মুক্তি পাওয়ার জন্য অনেকে স্কিন স্পেশালিস্টের কাছে যায়। ভেস্তানি হসপিটাল ডক্টর ডোয়াংকমল যেটা বললেন যে এটা সূর্যের আলোতে খুব বেশি এটার প্রখরতা বাড়ে, তীব্রতা বাড়ে, সেজন্য আরও অনেক চিকিৎসা তিনি করছেন এবং ভালো হচ্ছেন। ডক্টর ডোয়াংকমল, another thing is alopecia.
Yes, alopecia.
Which is very common.
Yeah, very common. Yes, it's very common in Bangladesh
patient. Problem, alopecia.
Yeah, I think.
What is the cause of alopecia?
Yeah, there are many causes of alopecia. The first thing I will ask first, what is the type of alopecia? But the alopecia that very common in your country is endogenetic alopecia. It's from the genetic. You have someone in your family that has a thinning of hair, so you have the thinning of the hair. The cause of this, you have the hormone that look like the male hormone high, and it make the hair small and fall. So the treatment.
Hormone is a very important role, has an important role.
The hormone you have the hormone that look like the male hormone that can make the hair smaller, 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 and fall.
Okay.
So you have the thinning of the hair. We can treat.
So what you do in Western
Yes,
hospital?
I give topical medication. I give topical medication such as minoxidil lotion to stimulate the hair growth. I give oral medication to stop the cause of the alopecia.
Any hair grafting you do there?
Thinning of the hair?
Hair grafting.
Hair graft. If you're concerned about the hair loss and you have the severe baldness, we can do hair transplantation.
Hair transplantation.
Yeah, you have oral medication, topical medication, and combine with hair transplantation if you are very concerned about the hair baldness.
If you do the hair transplantation, so you have to collect the hair from that person, or other person you can collect?
In our hospital, the plastic surgeon do this procedure, but we can do hair transplantation, but I'm dermatologist.
Oh, yes, even dermatologist. Dr. Doungkamal Western হসপিটালের যিনি চর্মরোগ বিশেষজ্ঞ, তিনি বললেন যে অনেকের মাথায় চুল পড়ে যাচ্ছে, টাক পড়ে যাচ্ছে, তার চিকিৎসা কিন্তু তিনি ঠিকমতো করছেন বিভিন্নভাবে। I want to make a question. Seborrheic dermatitis.
Yes, it's
very common.
Yeah, very common.
How you treat the patient?
Yeah, seborrheic dermatitis is the one type of eczema. It appears on the area that has seborrheic area, such as scalp, face, upper chest, and back. On the scalp, you saw that you have the dark scaly white on the scalp. Someone calls it dandruff, or you have the less scaly patch on your face because seborrheic dermatitis. It will be off and on. It is not completely gone. The cause is unknown, but mostly doctors think that from the years, that is a normal years, that normally is your seborrheic area such as scalp or face is overgrown in the time that you have stayed, you're unable to sleep, you have common cold, so it stimulates the skin cell differentiation, so you have the rash on the face and the scalp.
যদি আপনারা ডক্টর ডোয়াংকমলের সঙ্গে ভেস্তানি হসপিটালে যোগাযোগ করতে চান বা স্কিন এর আরও বিশেষ চিকিৎসা নিতে চান, তাহলে জিডি অ্যাসিস্ট নামে একটি প্রতিষ্ঠান আছে বাংলাদেশে, তাদের সঙ্গে যোগাযোগ করুন, তারাই আপনাকে পৌঁছে দিবে ভেস্তানি হসপিটালে, তাদের বিভিন্ন তথ্য দিয়ে আপনাকে সহযোগিতা করবে। দর্শক, এতক্ষণ আমাদের সাথে থাকার জন্য আপনাদের অনেক ধন্যবাদ। আপনার স্বাস্থ্য বিষয়ক যে কোনো পরামর্শের জন্য যোগাযোগ করুন ইম্পালস হসপিটাল 304/E, তেজগাঁও শিল্প এলাকা, ঢাকা। ইমেল impulsealamin@yahoo.com, ওয়েবসাইট www.impulseltd.org, হটলাইন 0171501627 নম্বরে। আগামী অনুষ্ঠান দেখার আমন্ত্রণ রইল। ততক্ষণ পর্যন্ত ভালো থাকুন, সুস্থ থাকুন, নিরাপদে থাকুন। সবার জন্য রইল অনেক অনেক শুভকামনা।